Alternative dressing change. The use of ChloroPrep and Tegaderm is the recommended method for Broviac dressing changes. However, there are times when either one or both of these can't be used because of an allergy or sensitivity. There are also times when your child may get a skin reaction for different reasons. Maybe the ChloroPrep was still wet when the Tegaderm was put on, or maybe the Tegaderm is being pulled off harshly instead of being lifted gently off the skin. All of these examples can cause difficulties. Therefore, your physician or nurse practitioner will decide if your child needs a different dressing. If your child does need a different type of dressing change, then you will use either alcohol and betadine or hydrogen peroxide and betadine. Broviac dressings using betadine instead of ChloroPrep are done a little differently than with the standard ChloroPrep. To do these alternative dressing changes, begin by washing your hands. Remove the old dressing, as previously shown, and look at the exit site carefully. Again, you should look for any redness or drainage. If there is redness or drainage, call your physician or nurse practitioner. After the dressing is removed, wash your hands again and open the dressing kit. Start by putting on the mask. Carefully open the sterile drape. And prepare to open the sterile gloves. If using Hypofix, which is not in the sterile kit, cut the appropriate size piece now. Now put on your sterile gloves as previously shown. Open each of the cleaning packets, making sure that you keep them on your sterile drape. Begin with hydrogen peroxide or alcohol swabs. Lift the Broviac gently so that the site can be cleaned. If you are right-handed, then you should lift the Broviac with your left hand. If you are left-handed, then you should lift the Broviac with your right hand. The hand which you lift the Broviac is no longer sterile, so it should not touch the exit site after it has touched the catheter. Start at the exit site with one swab and clean in a circular motion around the tube. Continue to clean in a circular motion, moving outward from the tube until the area that will be covered by the dressing is cleaned. Repeat the same cleaning technique with the second peroxide or alcohol swab. After the site is cleaned with 2 swabs, take the third peroxide or alcohol swab and clean the tube itself, starting where it comes out of the skin and moving toward the caps. After the peroxide or alcohol has been allowed to dry, it is time to use the betadine swabs. Clean the area in the same way you did with the peroxide or alcohol, using the 3 betadine swabs. Remember, start at the exit site where the tube comes out of the chest, and in a circular motion clean the same area you just cleaned with the peroxide or alcohol. The third betadine swab will also be used to clean the Broviac tube itself, starting at the skin and working your way down the tube. When you are finished with the 3 betadine swabs, it is important that the skin be allowed to dry completely. Do not blow on the site or use anything to fan the site, because that could allow germs to settle on the skin. Once the betadine is dry, it is time to put the dressing on. If it has been decided that your child cannot use Tegaderm, then you will be given Hypofix tape. Remove the backing from either the Hypafix or Tegaderm. Remember, do not touch the middle of the sticky part with your hands, as this should stay sterile. Loop the catheter and put the tape over the exit site and smooth out the wrinkles. After the dressing is on, it is time to add another small piece of tape around the tubes that are not under the dressing to give them added support. Use a piece of tape or a thin strip of Hypafix. Place the tape or Hypafix under the tube sticky side up at the bottom of the dressing. Cross one end over the tube and stick it to the dressing. Cross the second end over the tube in the opposite direction. It should look like a V. This will protect the Broviac if there is any tugging on it. The tape absorbs the tug so that there isn't tug at the site. Remember, if you use the betadine when changing the dressing, or if you use Hypafix, then the Broviac dressing has to be changed twice each week. Congratulations, you have just completed your child's alternative dressing change.